The government has published its proposals for the new junior doctors contract. It once again highlights how the government is trying to deliver an unfunded, untested policy without any evidential base on the back of frontline staff. You cannot stretch a 5-day elective service over 7 days without causing significant harm. The most important point is that when the government and the NHS employers say the contract was 90% agreed, this simply isn't true. Some of these supposed points of agreement do not reflect our talks with employers. Areas where we thought we had made progress, offering significant compromises, have been undone by this deliberate misinterpretation. There are parts of these proposals that are relatively uncontroversial, as you'd expect. But there remain areas of profound concern, and that's why we'll be taking industrial action this week. The contract proposals give with one hand and take with the other. They put a limit on night shifts, and yet where junior doctors work until 2 a.m, it doesn't count as nights, and there are no adequate controls. The government claims the Guardian will protect doctors and yet strips out safety precautions that have worked successfully for more than 15 years. If we are truly concerned about safety, we would be either adding safety stipulations or we would be testing our changes before introducing them. There are many aspects of the contract that we have negotiated successfully, and where there has been significant movement, this should be welcomed. This is the purpose of negotiations. We are not going to deny the successes we have achieved together, but a contract is clearly a whole package and it must be robust and fair, not simply cherry-picking 1 or 2 stipulations that benefit individual groups of doctors. With our working hours, there is a fundamental issue of fairness at stake. Our colleagues working at the highest intensity, often at night and weekends, are delivering absolutely vital care for their patients. We came up with a cost-neutral model that recognised the impact on personal and family life and increased the costs of childcare at evenings and weekends. It was rejected. So now we face an even greater recruitment crisis in many specialties. We have consistently tried to protect the principle of equality of pay, and consistently the government has rejected every attempt of ours to address these concerns. The complexity of this contract cannot and should not be boiled down to simple soundbite politics. It's not just about Saturdays. And when junior doctors get home, some often spend many further hours on call. The proposed allowance to cover this in no way reflects the burden on the doctors concerned or the costs of arranging childcare at short notice. We showed time and again that we were willing to talk, to negotiate and to compromise if we achieved a contract that was fair for doctors and safe for patients. That contract seems a distant prospect, far more distant than it seemed during the talks, thanks to the intransigence of this government and its consistent broken promises. On Wednesday and Thursday, we continue to show our support as one profession for a contract that junior doctors and their patients deserve. We must use this opportunity to say to the government in no uncertain terms, no doctor wants to take industrial action. Please get back round the table and let's avoid further escalation. We are one profession. We do stand together.